Thanks very much, Gary, and thank you to COTA Victoria for asking me to be part of this amazing session. COTA Victoria asks, and Tina said in the opening, will Australia's aged care system be fixed? And further, whether outcomes from the Royal Commission's recommendations will inspire the generational change needed for our broken aged care system. In unpacking some of the Royal Commission recommendations from a consumer perspective, I will have a go at answering these questions, but I want to say up front that I'm not sure the system can be fixed, or indeed that anything from a report comprising 5 volumes, and I think someone said 9 books because several of them have multiple parts, and 148 recommendations. I don't know that any of that can actually inspire anything, let alone the generational change we need to fix a broken aged care system. But on to the Royal Commission. Commissioners Linnell Briggs and Tony Pagoni provided their final report, Care, Dignity and Respect, to government on the 26th of February, which, if I recall, was a Friday, and Prime Minister Morrison tabled the documents in Parliament on the Monday or Tuesday following. I'm pleased to say that lots of people have, and their organisations have published reviews and reports and comments on and about the report and recommendations in the 6 weeks since then. And they have all been helpful because I am telling you right now, I haven't read the 8 or 9 volumes. I've had a good scan of the summary, but one thing I'm not going to do today is go through all of the recommendations, and that would take more than the time we've got. I want to draw your attention to something I found particularly useful, which was only released over the weekend. Consumer groups produced a joint statement, 12 aged care consumer organisations, and that joint statement proposes some actions to be taken. And I think on Monday as well, Provider Peaks also produced a more detailed 15-point plan than what they'd released before. So there's a lot of information out there. I have promised Amanda I will provide something in writing, and I'll make sure links to some of those key documents will be in my notes that I provide. So I want to start off really with a statement from the commissioners. They articulated their purpose for a new aged care system, that it should deliver an entitlement to high quality care and support for older people and to ensure they receive it. The care and support must be safe and timely and must assist older people to live an active, self-determined and meaningful life in a safe and caring environment that allows for dignified living in old age. Sounds pretty good to me. Can we get there, I think, is the real question. And I could spend my whole time just talking about that. I want to refer quickly to what some other people have said from those comments, and particularly Stephen Duckett from the Grattan Institute, who wrote that if the major recommendations are adopted, Australia will get a transformed aged care system over the next 5 years. And he gave just a few top highlights of what he thought the 4 key takeaway messages are: a rights-based system, a system with stronger governance, improved workforce conditions and capability, and a note that a better system will cost more. A lot of the other commentary I've noted has been about workforce, and I can't go into that in too much detail, but indeed, the Health Services Union head, Gerard Hayes, has said that we have to get remuneration right. And if the government doesn't get remuneration and worker conditions right, we won't have the workforce at all to deliver this new system that we hope and believe might be the outcome of the Royal Commission. There was also a concern raised by Professor Denise Jepson, the chair of Macquarie University's Ageing and Aged Care Researchers Network. And Denise is concerned about things like a proposed registration system for personal care workers and minimum qualifications as possibly being barriers, not just for new people entering the system, but also potentially for those who are in the system now and who might have a burden of needing to do more qualifications. I think, though, she did raise in her commentary the fact that whatever we do, the reform of the workforce, remuneration and conditions and so on should be both sector-wide and bipartisan. I think that's something we need to take on board. From a consumer perspective, I think one of the strongest responses to the report recommendations has been from COTA Australia, our national body, of which COTA Victoria is part. COTA Australia Chief Executive Ian Yates highlighted that there is no dignity in aged care without control. He identified that the recommendations lack a strong enough focus on choice and control, and went on to say, if quality of life is the goal of our aged care system, then it needs to be on our terms. That means seeing older people as full partners in the delivery of their own care and allowing them to make the decisions that work for them. Who bathes them? When they get up? When they eat? More importantly, who they see and when, something that was particularly relevant in the COVID era. So, broadly, consumer perspectives on the Royal Commission and its findings. Consumer concerns about the Commission findings have been flagged right through from the end of last year when Council Assisting put forward their recommendations. We can't be clear yet how effectively any recommendations will provide solutions to these concerns, but the kinds of things that have been raised by consumers and consumer bodies are things like insufficient evidence or emphasis on consumer empowerment, choice and control as a key aspect of this reform. The fact that care finders and case managers have not been independent from government, even though at some point there was an intention they were. And so they can't fully act on behalf of consumers when they're tied to provider interests. We know that consumers are concerned about full transparency and accountability of service performance, and we're not seeing that or the cost of implementing that. Confusion remains for consumers regarding the policy rationale and direction for things like system governance, which is one of the parts of the system that the Commissioners proposed. We also see there's a failure to address a sustainable way forward on financing. And just to make it clear that there are some parts of the report and recommendations where the two Commissioners didn't agree. So things like funding and finance, and also the possible structure of the new system would be things that there are divergent options on in the report and that government will yet have to make a decision about. We also see that there's been insufficient priority given to enhancing control for older people and their families, particularly in residential care, and that involves bed licence. So the next step really in a breakdown of provider control, shifting to consumer control, was the release of bed licences into the hands of consumers. One of the things I've been doing in my consulting time is actually volunteering on the Services Australia Aged Care Task Force, which has been looking at all the aged care forms and processes through Centrelink. And I've heard a lot of comment and seen the evidence of the complexity of the aged care system as we face it now. Over the past week since the release of the report, the most common thing I've heard from consumers has not been about detailed recommendations, has not been about the specifics of the report, but is really about how to achieve this generational change we want to need. The size of this task is daunting, not just for us, but for government providers and workers, but even more so for individual consumers. So how do we go about influencing the answers? As individuals with a commitment to better aged care, as consumers and stakeholders collectively, what can we do to help fix Australia's aged care system? Can we, individually and collectively together, be the inspiration to bring about generational change? The joint statement that I've referred to from the 12 aged care consumer organisations, which was released on Sunday, and I'll put the link in my notes. It is available on COTA Australia's website. The organisations, the Association of Independent Retirees, Carers Australia, COTA Australia, Dementia Australia, Elder Abuse Action Australia, FECA, Legacy Australia, LBTIQ Plus Health Australia, National Seniors Australia, the Older Persons Advocacy Network, the PICAC Alliance, and the Returned and Services League of Australia. So it's a very broad group representing a huge number of Australian aged care consumers and older people. The purpose of their joint statement was to provide a clear, unified voice to government. It's inclusive of the views of current and future older people who are using aged care, including those who face barriers to access. The statement conveys the signatories' expectations of government in advance of its budget and comprehensive response to the Royal Commission. In broad terms, the statement seeks to highlight key items that must be acted upon in the 2021-22 federal budget, as well as items that require further consideration beyond that timing. So the clear action steps that the joint statement puts forward, there are 10 key asks, and they have multiple recommendations or start with an ask, followed by a consumer statement, and then go on to explain what older people want. So, for example, the first ask is a Better Aged Care Act, which again is one of the major recommendations. What do consumers want? A Better Aged Care Act that is designed to uphold human rights, to ensure consumer choice and control, containing stronger protections for consumers and better accountability of aged care providers, with tiered enforcement measures and penalties. So we won't go through them all, there's just no time. The other consumer-focused actions and asks are proper recognition and support for the role of informal carers, something that we've been advocating for many years. Easy to understand information and local solutions. Services that are inclusive, culturally safe and sensitive, and better integration of other health and wellbeing services with aged care. So if all those things are addressed, we will see the required change in the next and subsequent financial years. I do want to highlight though, a surprise that I found in that joint statement, which links back to the recommendations. That is, there's a diagram, which I'm just going to hold in front of my camera so you can see it. Might be back to front. You'll know what you're looking at when you see that multicoloured thing. And that's a diagram of the proposed structure or the recommended structure that these 12 consumer organisations have proposed. And in that, there are two things that caught my eye. The Implementation Task Force and a council of elders. Council of elders, in some very small print, says underneath, must include lived experience voices. And the chair of that council of elders would be a member of the implementation task force sitting under the top government structure. I've spent nearly 10 years working in peak bodies that have a focus on ageing and aged care, including those that represent providers and consumers. This is the first time I can recall that we've come close to having a governance model that includes people who are actual users of aged care services and potentially family members and carers of people receiving services as active participants in the governance model. So for me, this is groundbreaking. I believe that our consumer peaks and advocacy groups, like these 12 signatories, like COTA Victoria in bringing you the conversation today, are doing a fantastic job. But somehow this feels different. Is this our chance, not just to fix the aged care system, but to use this opportunity to have voices at the table, indeed voices at multiple tables, to inspire the generational change we need? A quote from the launch of the statement over the weekend from National Seniors Australia CEO, Professor John McCullum. Much can be achieved in the next year to give older Australians genuine self-determination, to hold providers accountable for failure to deliver quality care, to treat those who need support with dignity and respect, and to enable and reward excellence. Certainly agree with that. Ian Yates, Chief Executive of COTA Australia, followed up by adding, we recognise the government faces significant challenges in implementing the Royal Commission's recommendations in full, including the need for major budget funding and a major increase in workforce. But these challenges must be met. This is Australia's line in the sand moment for giving us the aged care system that we need and expect. I couldn't find an inspiring or positive quote from the commissioners, so I'm using another one of Ian Yates. In the Daily Telegraph on Monday, he said, a new aged care system must tip scales towards the individual and give older people genuine self-determination. That means control over the culture, choice of care and service delivery, and full transparency from providers. Protecting the dignity of older Australians is not just a moral imperative. We should build an aged care system that we will one day be content to live in. So, will Australia's aged care system be fixed? According to our expert commentators, it can be if the federal budget on the 11th of May and the government's response to the Royal Commission due by the end of May provide commitment to the investment required over this budget and the forward estimates to achieve that purpose set out by the commissioners, to deliver an entitlement to high quality care and support for older people, and to ensure they receive it. Care and support must be safe and timely and must assist older people to live an active, self-determined and meaningful life in a safe and caring environment that allows for dignified living in old age. Let's hope we get there. Back to you, Gary.
Thanks, Judy. Thanks for summarising the 9 volumes into 20 minutes, which is quite an achievement. Although I do note that at the beginning you said you went across the 9 volumes, which I'm a bit surprised about, but neither am I. And thank you for focusing on some of those issues, such as transparency and the rights-based approach and the training of the workforce and so on. I suppose from my perspective, one of the things that you did sort of focus on predominantly was this notion of self-determination. And I suppose one of the questions I have, especially with the recommendation for the establishment of a council of elders, is how does an individual who's resident in an aged care home have input into that sort of level, and how do we actually make self-determination part of the culture of aged care homes so that there's not repercussions for people when they do have input?
I think it's evident that what we've seen with this move to online engagement over the last year, that there is actually more opportunity for people who are residents in aged care homes who are in their own homes but struggle to be out and about, that there is more opportunity to be engaged. I know Mel Mitchell's an apology for today, but we've seen what a powerful advocate she was in the Royal Commission itself. And I'm on a number of advisory groups and panels as a consumer advocate for the Australian Digital Health Agency. And I would say all of the ones focused on ageing and aged care, and there are several at the moment, have people who are residents in various settings, aged care settings, and small home models, who are able, by virtue of an iPad, to be able to participate. I think the real challenge, and it's something I struggle with as a consumer advocate, is that we come as individuals and we know this thing about self-determination is that with, 86 people on this call, we're all different. Our needs are going to be different. Our preferences are going to be different. Our choices are going to be different. I remember when my mum was facing the need for a level of care, she didn't want choice and control. While I was out there advocating for it, she wanted to be looked after. And that's just as valid a choice as people like me fighting for my cousin in Adelaide who needs care at home and can't get it.
Yes.
So I'm hopeful, Gary, that we can make life easier, that at this system level that we have some voices. We know that a representative can't represent everyone's voice, but they can use their lived experience to convey that the diversity that we see, and the fact that self-determination in the purpose statement, self-determination as a goal of the system can only be achieved if real people with real experience of how systems work are at those tables, not just one table, but all of the tables.
Yes, I agree.